Hey, everybody. So I'm going to give it just a second for folks to get in here and we'll chat for a second. I know that I said no live today, but I want to give you guys some information and just feel the need to do a little bit of clarification. So I'll wait for folks to get in here. So, hey, cuz, how are you? You guys doing all right? Hey, Tim. So I'm gonna continue to give it just a second. I'm tired and took today to shut down. Hey, Will, I know that we still need to check. We still need to chat, and so we can do that. Hey, Athena. Hey, Lisa, how are you? How is everybody? So I want to make sure that I give you guys some really good information. Hey, Mandy. I am back at home. I will not be resting, though. I have a ton of work that I need to catch up on, that I need to get done in order for me to even have a remotely decent chance of enjoying my Christmas. So I'm going to be here working. Hey, Sonia. I appreciate that. You're welcome. So I got to sleep around, I don't know, almost 2 o'clock this morning. Hey, Crystal. And I got to sleep around 2 o'clock this morning. And then I got up and I got on the road to come back home at about 6 o'clock this morning. I got on the road at 6:15. Hey, Kim. Hey, Darcy. How are you, boo? I still need to come to Louisiana. So, but I do want to take a second to talk to you guys and give you some information, and then just kind of share some things that are just coming straight from me, okay? So my mama made me some tea. Have y'all ever had Russian tea? Y'all know what Russian tea is? My mama mixes up Russian tea for me, especially when I've got this cough still and whatever. And so I came home and made me some tea and some honey and that sort of thing. So that's what I'm doing. But I want to dig right in, and I will tell you this. I'm going to get into some trauma truths. There have been some things that Alan Levine has thrown out. He's compared us to different markets and different areas. And, one of the places that he brought up is Charlotte, North Carolina. And, I lived in Charlotte for 9 years. So, see, Evie, we're on the same page. I lived in Charlotte for 9 years. So I thought, it would be great to take a look at his information and his references to Charlotte versus like the truth. So I thought that would be nice to do, right? So let's get going, okay? All right, so first I want to start with boundaries. Some of you have tried to reach out to me today, and some of you have been sent to voicemail or just ignored. And I'll explain why that is. One of the things that I've gotten really good at is establishing my boundaries and sticking to them and not feeling like I need to justify them. So if I say to you, I do not want to talk right now, you can ring my phone until you're blue in the freaking face. And if I don't want to talk, I'm not talking. So some of you, now here's what I need for you to understand. Don't take that personal. It has nothing to do with whether or not I like you, whether or not I love you, whether or not, I think you're a good person. It has nothing to do with our relationship. It simply has to do with the fact that I have learned how to set my own personal boundaries. And when I got as pissed off as I got today, that's a sign for me. That's a sign for me to just disengage, right? So, hey, Daryl, hey, LaDonna, hey, Michelle. Like, that's definitely a sign for me. So here's one of the things I'm usually very good at. I'm usually very good at not taking things personal. I can usually see where someone's coming from, understand their position, their mentality, their thought process, and know that the way that they're thinking has nothing to do with me. That's usually something that I can do pretty well. Today, that did not occur. And usually what happens for me is, and I don't know if you guys can relate to this, but usually what happens is if I've been giving, and I'm giving from a place where my cup isn't full, right? And then someone says something that could be taken personally, that's usually, if I take it personally, that's an indication for me that my giving needs to slow down for a minute. My giving needs to, I need a minute to recoup before I revert to, old behaviors and old thought processes that I just don't engage in anymore. So today, I got upset because I had a discussion with someone around passing certain resolutions, and we disagreed. And I very vehemently disagreed. And I want to share this with you all. So for all of you all who are watching that are county commissioners, that are board of supervisors, that may be in politics in some way, shape, or form, I want you to understand that I'm a resource for you when it comes to protecting the rights of your people. I will absolutely stand shoulder to shoulder with you and push and hold people accountable who need that when it comes to protecting the health and well-being of that region and your constituents and your residents. What I am not here to do is help you get reelected or get to a different position or to advance yourself politically. I'm not here to kowtow to what you may or may not want to do for your particular county and your particular region. That's not what I'm here to do. I am here to protect the health and well-being of every single county, every single constituent, and where they are doesn't matter to me. So I just need to put that out there. And it still has nothing to do, yeah, Jamie, you made me laugh when I saw that. It still has nothing to do with whether or not I like you, whether or not, I think you're a good person. Like, it's not personal for me. So I just want to be very, very clear about like me. And at any point in time, I need for everyone to understand this, that if you engage in behavior that I consider to be negatively impactful to the public's health and well-being, whether you work for Ballad Health or whether you work for the government or whether you whatever, you can be on the other end of a live. You could be on the other end of me calling you out. You know what I mean? So I just need for everybody to understand, I'm not here to play favorites. I might like you as a person, and it has nothing to do with what I'm willing to do and what I'm willing not to do. So, I just need for you all to understand that. And some people might not like that. I get it, but that's okay, because, if you don't like me, I don't live there. It's okay. You know what I mean? Hey, Shari. So I just want to put that out there. So those are my boundaries, folks. I'm not here to help you do anything politically advantageous for you. If that's a byproduct of your sincere efforts on behalf of the public, great. But if that becomes an agenda, if that becomes a motive, if that becomes a conflict of interest, we are going to disagree. Period. Got it? So just letting y'all know that. Now that we've cleared all that up, okay, I still love you, all of you. You can still love or not love me. Either way, it's okay. But I needed to be very clear about that, okay? So there we go. I appreciate that, Scotty. Hey, Sarah. I know, Chris, everybody has gotten those, and that's okay. I covered it on a couple of lives. So listen, folks. Here's the deal with the consumer complaints. They may come back to you. If you all remember the live that I did when I was all snotty and upset because I'd gotten my consumer complaint back. And I was like, why did you all send me to consumer complaints if they can't help me? And I was all mad. And that's the day that you all blew up Janet Kleinfelter and she ended up calling me back. I'm expecting for you guys to get those letters in response, and that's okay, right? What's important is to show the sheer number of people who were willing to file the complaints, because that helps us in our case when we're talking to the Tennessee State Health Department and so forth and so on, okay? You're welcome, Jeff and Renee. Renee, I saw that. Of course, I read your name and then I got to Renee at the bottom, but you're welcome. Okay, so I want to talk trauma truths for a second, okay? So, I've listened to Alan Levine talk a couple of different times about Charlotte, North Carolina. And he's even said it to me about Atlanta. Well, Atlanta only has one level 1, and Charlotte only has one level 1, and Atlanta has bad traffic. And let me just say a couple of things. Atlanta has bad traffic about twice a day. Rush hour happens twice a day. Atlanta is also a place where regular roads are 4 lanes in many, many places. Like if you look in my neighborhood, 4 lanes of traffic, and the interstates have 4 to 6 lanes of traffic, sometimes even 7, depending upon the exits where you are. So you have to understand the capacity for the areas in which you're talking about. So like Charlotte, North Carolina just finished their 485 loop all the way around. They're expanding 77 along the same way, and Interstate 85 is easily 4 lanes and things like that. So you have to be thinking about all of those things. So Richard, I'm aware of that Highlands Physicians Group, that lawsuit that started out with Ballad, and I think everybody's aware of it, and that's great. But I want us to make sure that I want everybody to kind of like not get distracted. I really want to use this to be informative so everyone is aware. Now, so listen to me. When we talk about Charlotte, North Carolina, you hear him talk about, Charlotte. Well, there's a couple of truths that you have to know about Charlotte, okay? Number one, there is one level 1, right? You're also talking about 1 million people that are within 30 to 40 miles of Charlotte. That's not what we're talking about when we talk about the Tri-Cities and Northeast Tennessee and Southwest Virginia. It takes, in order to get the 1 million people, you have to go about 80 to 90 miles in either direction to equal the same volume of people. So Mr. Levine, this is a great time for us to use your volume scenario. Let's talk about that. So if you downgrade Holston Valley Medical Center and Bristol Regional to level 3s, and then Johnson City becomes the only level 1, and everyone is diverted to Johnson City, then because how rural that community is there, hey Hunter, what you have is you have not enough volume coming to to Kingsport, to Holston Valley, and not enough volume coming to Bristol for those folks to stay busy, to stay up on their skills, to stay proactive in what they're doing, and you will lose physicians that way, right? So that's something that's really important to consider. Love you back, Terry Cook. Now, let me just say this. When you talk about Charlotte, Charlotte does have 1 level 1, but also within that same 30 to 40 mile radius, they have 3 level 3s. And they have the population that justifies a volume that will keep those 3 level 3s up to par when it comes to stabilizing in order to get people to that level 1. So I need for you to understand that between Charlotte to the outskirts of like Gastonia, which is about 25 minutes or so, you're going to have 4 trauma centers, 3 level 3s and 1 level 1. Now, get this, when you go about 77 miles away up to Winston-Salem, you find North Carolina Baptist Hospital, which is also a level 1. Now, here's the difference, folks. Let's just say that the level 1 is in Johnson City. If you go 78 miles away, 77 miles away, you're going to get into Southwest Virginia, but you're still going to have to go another 77 miles on the other side to reach another level 1 in Roanoke. Whereas in Charlotte, you got 1 level 1, and at the end of 78 miles, you have another level 1. That's not the case. In the Tri-Cities area, what you would have is a level 1 in Johnson City. You would go 77 miles up to Smith and Wythe County, right? But you wouldn't have another level 1 there. You'd have to go another 77 miles up to Roanoke. So when he says that, you have to understand that there's a difference between from 1 level 1 to the next level 1. And then from that level 1 in Winston-Salem, you travel 30 miles to Greensboro and you found Moses Cone. Now Moses Cone is a level 2, right? So 30 miles in between that level 1 and that level 2. Okay, so then let's keep going. Let's go from Moses Cone down to UNC, Duke, and those two, of course, we know those 2 facilities are 9 miles away, right? Okay, Tim, see you later. But from Moses Cone to UNC and Duke is another 30 miles. So follow me. You have a level 1 Charlotte, right, with 3 level 3s right around it, right, all within 30 miles of each other. You go 78 miles, you have another level 1. You go 30 miles from there, you have another level 2. And then you go 30 miles from there and you have 2 more level 1s, right? And then if you go another 77 miles, you're at Vidant Medical. Now, Vidant Medical is another level 1. See what I'm saying? So what would happen is in North Carolina, they have 6 level 1s, 3 level 2s, and 6 level 3s. And it's important to understand that 3 of those level 3s are right in the Charlotte metro area. And that's 1 million people right in Charlotte. So when you have Charlotte and you have, you know, Pineville and Mint Hill and Matthews and Concord and Huntersville and all of those surrounding communities, that makes up 1 million people just in that Charlotte metro area. It takes us all of Northeast Tennessee to all of Southwest Virginia to equal 1.1 million. So, you know, it takes us 22 counties to make up 1 million people. It takes 1 or 2 counties for Charlotte and them to make up 1 million people. Do y'all understand the difference? Now, let's talk about the trauma centers themselves in Charlotte. In Charlotte, North Carolina, there are 22 trauma surgeons, folks. For 1 level 1 and 3 level 3s, there's 22 that I could find just today. And 13 of those are orthopedic trauma. How many trauma surgeons does Johnson City Medical Center have? How many trauma surgeons does Holston Valley have? So again, it's important to understand, he's not planning on staffing Johnson City Medical Center the way that these hospitals staff themselves. They have 1 million people right there locally. So at any point in time, give it rain or give it snow or just bad driving, you can have multiple traumas all at one time in the Charlotte area, and you're gonna have enough trauma doctors in that immediate area to support and take care of every single one of those patients. You are not gonna have that at Johnson City. For goodness sake, you can only land 1 damn helicopter there right now. Right? So we have to be reasonable and not just throw figures out and not just throw communities out, because they're not the same thing. Right? Those are just the plain old facts. Right now, what I can tell you is that there is such a nursing shortage that we have right now. People are not even being treated in the emergency room. They're being called back to triage and having tests done, and they're being sent back out to the waiting room. You've got nurses that are being pulled up on floors because they don't have anybody to actually watch patients. And you got nurses sitting in between 2 and 3 and 4 rooms watching people who are on suicide watch because they don't have enough. And yet, they're getting rid of floating nurses. The floating nurses are ending December 22nd. Right? So this is the point that I really want us to, like, when we start to talk about these changes, it's not just that people want to keep things the same. It's that there's a logical reason for what we desire to do and what just makes good sense. You know, he talks about a tertiary system. Okay, let's talk about that. When we talk about tertiary care, okay, so I've had to see a tertiary orthopedic surgeon. Okay, my tertiary orthopedic surgeon was Dr. Glenn Terry. He just passed away last year. He was the 92 and 96 track and field Olympic Games doctor. Okay, there are 6 hospitals in the state of Georgia called the Houston Clinic, and it's a teaching hospital. Like when you're a tertiary physician, right? It's a teaching hospital. So that's why Duke University and UNC Chapel Hill, they have programs that make it tertiary facilities, and there's research that happens and education that happens and all of those different types of things. So call me crazy, and this is just the way that my brain works when I start to think about things. And I'm going to talk about Greenville in just a second, okay? Here's what I want you all to understand. There are going to be changes that are made that are not violations of this COPA. There are going to be changes that are made that are specifically detailed in this COPA. Greenville is one of them. So we're going to talk about that, okay? But so I just want you guys to listen. So this $300 million that they're talking about spending, instead of taking these hospitals and reducing them down in terms of the services, instead of reducing down staff, reducing down services until they're basically operating on a skeleton crew in order to improve your profits, right? Just to meet the terms of the COPA, because that's literally what's happening, right? When you shut down, so like I can tell you this because I have the pictures to back it up. In Norton, Virginia, they have pretty much closed down the med-surg floor. They've shut it all down. It's empty. It looks like a damn ghost town. I will post the pictures later. So someone from in the hospital sent me that information. They have their ICU beds are down to just 2 now. down to just 2, and they combine the rest of them for med surgery, and then they close down the surgery stuff. So I literally have those pictures and I can show them to you, okay? So here's the thing. The way that they get away with doing things like that is because technically the hospital is still open. Technically, you know, it still has an ER, so people are still being seen even if there's only 12 beds in the whole joint, right? So it meets the terms of the COPA. The COPA says you have to keep the hospitals open for 5 years. That's what it says, right? So they are. They are. But what good does it do for a hospital to have the damn doors open if you can't be treated well there and get the care that you would normally have? So for me, what that shows is bad faith. And I kind of talked about this last night. I don't want someone who says, oh, what's the minimum that I have to do? And I'm going to do just that so that me and my cronies can get our $400,000 bonuses this year. And that's what it boils down to, right? Okay, so we'll talk about, all right, so let me explain the nursing pay. Again, this is an example of doing the bare minimum. So here's what they did for the nurses, okay? Here's what they did. They got rid of the differential pay and they added it into their base, and they made this big deal about how that was going to be better for you because you were going to get more PTO based on your base. They'd give you $5,000 for up to 2 children if you wanted to adopt, and all this other shit that doesn't apply to 99% of the people, right? But what they did is they took what you made over the last year. So let's just say, so check this out, guys. Let's just say that over the last year, you only worked 1 weekend and, you know, and 1 night shift, right? They took that differential that you made, or whether you worked 100 of them, they took that differential from what you made last year. They divided it up over the course of the year and said, hey, if this person were to make this exact same amount of money, what would their base need to be? Now, here's the thing. It said nobody was going to get a pay cut. So what happened is many of you, I've actually seen the letters, folks, where people went from $25 an hour to $25.01 or $25.03. They gave them 3 cents more on that base just to be able to say, hey, we didn't lower their pay. I think that sucks. And here's the thing. So for example, if you got 3 cents more on your base pay, right? All it would take, that would mean that you would make an extra $51 for the entire year. Well, if you worked 1 weekend shift and 1 night shift with the old differential pay, you would make more than that over the course of the year. So that's what they've done. And again, legally, they're within the confines of the COPA, legally, right? But what it does for me is it says to you, I don't value you. I'm not doing something for you. I'm going to do the bare minimum that I can to meet what I'm legally required to do. And then I'm going to work you like a damn dog because half of you are going to leave to go work other places. And I'm going to put patients' lives at risk because there's not enough nurses to cover them. So nurses who used to have 4 and 5 patients now may have 7 and 8 patients and be running up and down between floors. That's what's happening. Right, Crystal, that's what this does. This puts everybody, that's what they say. Okay? So again, this is something that I really want. This is the stuff that I really want to have conversations with when we talk about, you know, when we look at what's being done and how people are handling the changes, okay? And you know, some people, I'm telling you, some people have started to be traveling nurses. Some people, like if you're up in Southwest Virginia, right around the Wise area, many of those folks have gone up to Pikeville. You know, people are going different places for employment if they can. There are a lot of people that can't. And so every day, some of these nurses are having to choose between doing what's in the best interest of their patients, right? And putting their nursing licenses in jeopardy, or just simply trying to keep their gainful employment. And that's a sucky place to be. No employer should be putting people in that position. So I will tell you, I sent an email today to Jeff Ockerman at the Tennessee State Health Department. And I said, Jeff, I have a question for you, because the COPA says that you cannot, terminate employees except for cause for the first 24 months of the COPA. So my question to Jeff Ockerman was, can you explain to me what cause means when Tennessee and Virginia are at-will employment states? So I'm still waiting on a reply for that, okay? So that I can give you that information, because it's hard, it gets a little ambiguous and a little confusing about, you know, what can you do when they technically meet the bare minimum in terms of what they're keeping, but it does have an adverse effect. And this is one of the things it says. Okay, so follow me, check this out, guys. It's very hard to find work in that region that is not under the umbrella of Ballad Health, right? So if that being the case, that would not be the case if there were still two separate companies with competition. Because if they were two separate companies with competition, and one of them was doing the same thing, then you could just switch hospitals, right? So what that is a disadvantage from a lack of competition. And that's something that the COPA specifically addresses. The COPA specifically talks about if there are any disadvantages from the lack of competition as a result of this merger. Okay, so those are the things that, you know, we need to have addressed and that we're gonna have addressed. And just try to kind of take this thing off one bite at a time. But I wanted to give you all very, very specific information regarding one of the areas where Alan Levine was referring to traumas, what that truly looks like geographically, what that truly looks like in terms of the number of specialists, and how you just cannot take that and apply it to us, because it's not the same thing. If it takes us 6,000 square miles to get a million people, and it takes Charlotte 40 square miles to get to 1 million people, you can't compare them. Okay, so, and let me just tell you this, guys. Let me just say this. I do have information regarding surgery centers. I am not going to go into that tonight, and I'm going to tell you why. There are changes coming with your surgery centers. There are changes coming. They are going to have an impact when it comes to some increased costs. That's going to happen. I'm going to go into that in a little bit greater detail when I've had just another day or so to, number one, decompress a minute, and then dig in, do a little bit of reading, talk to some other people, make sure that I have my head fully wrapped around it. Because I get the gist of it right now, but I want to be able to give it to you clearly and concisely so that you are well informed, and I don't want to get you riled up. What I will tell you is there are changes to your surgery centers happening. They are changing. The people running them, the management of the centers is changing, and it is going to result in increased costs for the patients. It will have some benefits for the doctors and the surgeons, but not for the patients. So we're going to talk about that. I just don't want to get into it tonight until I can give you full details. So here's what I'm going to ask you not to do. Please don't get off this live and go running around saying, oh my God, they're messing with our surgery centers and da-da-da-da. Don't do that. Just wait until I can give you all of the facts and all of the details, and then we can have like a real conversation around it. Don't go just like throwing out half stuff that you don't know the full details on. I'm going to ask you all to do that, please. Okay. Vince, I can't tell you why 3 stitches cost $3,000. Here's what I will tell you all on that note. Here's what I will tell you all. I saw someone who got a bill for over $2,000. Okay. This person pulled their medical records. They took that $3,000 bill. They pulled their medical records. They had to go down and ask for the full medical records, and they had to ask for an itemized bill. When they compared those two things together and had a very direct conversation with Ballad Health, that bill had to be adjusted. And after insurance and adjustments, their portion of the bill was less than $200. So what I would encourage you to do, if you are getting bills from Ballad Health and you feel like they are astronomically high, I am encouraging you to get an itemized copy of that bill, get your full medical records, and do a comparison. And if you need help looking at them, you know, email them to me and we will look at them together. But I'm encouraging you to do that, okay? So the new RN graduates are just under $18 an hour. I believe, and I'm just off the top of my head, it's something like $17.87. It's right around $18 an hour for the new nurses. Okay, so where are we now and what do you need to be focusing on? Where we are now is the COPA review, the annual review of the COPA is coming up. There's also a local COPA review as well. My understanding is that it has been scheduled for January the 22nd. Once I get at Northeast State, once I get that like locked and loaded, and I'm sure, because I just got it by text today, I will put that out there for you guys. What I am doing is, what I recommend that you all do is that we contact, hold on guys, this call. What I'm asking everyone to do is to send emails and phone calls and ask the state of Tennessee if the state of Tennessee can do the review here. And here's my thing, right? If we already have one scheduled for the 22nd for the local review portion of it, why not have them a combined review or do the local portion one day and then the state portion the next day, right? So that it can all be concisely done and together. I do not feel, if you're talking about a region that has a poverty rate of 20 to 40%, I don't feel that the state should put a burden on the public to try to figure out a means to get to Nashville to express their concerns and to be a part of this COPA review. I believe that the COPA review is so important and the public deserves to have some sort of transparency, since there seems to have been so little up until now, that the state, if there's 5 of them, for goodness sake, you guys buy a plane ticket, come on down here. If you need to be cheap, share some hotel rooms and come on in here together, right? You want to be emailing Judi Knecht, Jeff Ockerman, the Attorney General's office, even the governor's office if you wanted to, but literally it's the Tennessee Health Department and the Attorney General. That's what we want to have happen, because it's going to be easier if they come here, well, not here to Atlanta, but if they come there to Kingsport or to Northeast Tennessee State University where they're planning on doing the local COPA, and the public has the opportunity to be there locally, then that's a better solution. That's an ideal solution. And I believe it's a more fair solution for the public. So I'm going to encourage you all to reach out to those folks, and also get your commissioners, get your congressmen, get your senators, get those folks involved. I can tell you that there has been some conversation with like John Crawford and Gary Hicks and things like that. Well, that's what I'm asking, Jamie. That's what I'm saying that I want us to do. So the local COPA review is going to be at Northeast State. What I'm asking is for the state review to also be in the local area. And so what I'm encouraging you all to do is to get your commissioners and to get your board of supervisors and to get your senators and your representatives and make your voices known. Say, hey, get them to come to us. Okay, because that's fair. It shouldn't be on the public to try to figure out how to get 4.5, 5 hours away, afford a hotel room in Nashville in order to hear about something that impacts their health and well-being. You know what I mean? So that's one thing that I really want you guys to focus on. The other thing is to keep emailing them your concerns about the downgrade of the NICU, about the consolidation of the level 1 trauma centers, about the downgrade of Bristol. You guys, that one, people haven't been making as much noise, but I need for you guys to understand Bristol is a level 2 right now. Bristol is a level 2. That level 2 has 24 specialties, okay, 24. And if it gets downgraded to a level 3, it's only going to have 4. So that means Southwest Virginia right now would have, right now they could at least get to Bristol and have 24, but if you downgrade it, then they're down to 4. So we need to make sure that Bristol is a priority, and I'll tell you why. It's not mentioned in the COPA. The pre-approved section of the COPA only talks about the consolidation of a level 1. It does not mention downgrading Bristol from a level 2 to a level 3. That was never pre-approved. So just like the commissioner, I will, Hannah. I always put it at the top of the live when I get off. But just like the commissioner said to, so this is a big one. I need you guys to listen to me. So just like the commissioner sent out that letter and said, hey, we're not even going to consider downgrading this NICU because we don't have enough information, right? He needs to send that same letter out and say, hey, we didn't tell you could downgrade Bristol, so you need to provide us information that justifies this, because I don't believe that they'll be able to do it. So we need to demand that same way that they have pumped the brakes on the NICU, they need to do the same thing for Bristol. And every piece of equipment that has been taken from Holston Valley that impacts trauma needs to be taken back. And every piece of equipment that has left Bristol needs to be taken back. Okay? So those are the things that you all need to be saying. And the verbiage that I really do want you all to use is this. Listen, you all need to be able to say that these changes are creating a negative, a disadvantage to the public, and it's having a negative impact on population health. Disadvantage to the public, negative impact on population health. Because number one, those things are true, and number two, that's the language in the terms of certification. Okay? So those are the things that I really wanted to equip you guys with so that you would know what you need to be saying, what you need to be doing. Now, for those of you who are like, oh my God, she's back in Atlanta, so things are going to slow down. They're not going to slow down, okay? They're not going to slow down. There are no more Board of Supervisors meetings or commissioners meetings between now and the first of the year, right? It's the holiday time and all of that. So I don't need to be there traveling to county to county to county anymore. I can come home, I can relax for a few days before I come back for Christmas, and then come back here. So I will still be coming back and forth, okay? I will be coming back and forth, but we can be just as impactful with me here as we have been with me there, okay? So I need for you all to understand my geographic location is not important. I'm gonna be just as involved, just as adamant, and just as disciplined and consistent in my efforts as I was there. Jamie, we don't even want to talk about my poor little plants. My plants have got to be cussing me out. My big one was just like all drooped down. It looks so pitiful. Oh my gosh. So, and we don't want to talk. I washed my clothes, but they're on the couch. I haven't folded them. I haven't put anything away, any of that stuff, but I'll get it. I'll get to it. Right now, I want to get rid of all this yucky stuff that I have going on. But I wanted to get rid of the trauma myths, and I wanted to talk about the real volume that the issue and how volume would be impacted. So like, it's so funny because you heard Alan Levine say, well, people have to have volume to keep their skills up, right? Well, no, Sandra, my feather, yeah, yeah. You got to remember, we started this with me in Atlanta. You know, I came there like, what, 5-6 days afterwards. But listen, so, you know, these myths around volume, when he says, oh, lots of volume means better care. And he said, you know, well, you need lots of volume to keep your skills up, but yet you want to take away the volume from Bristol and Holston Valley, and then expect us to believe that people are going to be able to stabilize these trauma patients. It just doesn't make sense. You're talking out of both sides of your neck. And, you know, I keep saying this, and I'm going to keep saying it. We are country, but we are not stupid. There's a difference between those two things. So, and I just don't think that they were counting on that, you know? Country does not equate to stupid. So, anyway, now that you guys have some good information, please make sure that you pass it on. Please make sure that other people are aware. So that we can keep the heat on, keep the information going, keep demanding that they hear your voice, because they are. And I will say it one more time, kudos to freaking Hawkins County. You guys were amazing, not just in your respect and in your consideration, but in your willingness to listen and your desire to hear about the things and how they were going to impact you guys. So Barbara, I have a PayPal that I set up like a page for people, and I appreciate you asking. So I started out with the packets. I started out going up to Office Depot and paying to have them printed. And then I was like, forget this. By the time I realized I was going to be going to so many of them, I actually bought my mom a new printer. I just bought her a new printer and some ink and some paper, and we just started doing it at home. So that's what we were doing. Shout out to my mama. She highlights for me. So like the first one comes out and I'll highlight, and then she highlights the rest of my packets and puts them together for me. So that's what she did while I was there. So that's one way. I'm hearing from some folks who don't do like PayPal and online stuff. How can you do it? And what I'm thinking about doing is asking one of the two people there that I know to maybe get with some of you guys if you want to give it to them and them give it to me. So that may be something if you don't use PayPal or whatever. But anyway, I think that's just about it. I'm going to go because I'm getting all choked up. I'm still like, I'm going to make some more tea actually. So hopefully this was beneficial to you. And the trauma stuff really helped in terms of wrapping your head around it. I hope that we all have a really good understanding of what's happening with our nurses, and the pay and all of that. I will tell you this. One of the letters that I saw said that night differential, which is $3.45 an hour, is going to go away. But then when that person asked their supervisor or their manager about it, they said, oh, no, it's not going away. And here's the thing. What I will say is let's go by what's in writing and not by what we hear. If you want to trust what somebody tells you, that's on you. I personally would be asking to get it in writing if that's what people are telling you. So just throwing that out there for you guys. Other than that, I saw all the messages today. I just was not in the right frame of mind to look at them, and I'll be back on track. I just have a lot of work that I need to do to live. So I appreciate you all. So y'all know how, yeah, so the new nurses are making just shy of 18 from what I was told. Now I don't know, all the different levels and all that. Okay. So just so you guys know. All right. I appreciate all the prayers and thank yous, and you're welcome. I'm going to get off of here. Y'all know how I end this, right? You can say it with me. By this time, y'all should have it down pat, right? Be amazing. Be light. Be love. I'm out. Peace.